Guys, I'm Dr. Mark Koldenhoven, and I'm just coming here to give you a few tips and pointers on what to do if you have a acute pain situation of either your low back or your neck. There's many things that we can give you to do, but I just wanted to highlight 5 of them that might get you through that pain. But I just want to let you know that if you do have any severe pain, that's the time to consult a doctor and find out what truly is going on. So with our patients, all we want to do is get them out of pain as quick as possible. So those first few visits, what we tell them to do a lot of is to ice or heat their area of pain. So if you have that severe pain, you might want to try icing that area. When you ice, we suggest only to ice that area for 10 minutes at a time. That will reduce the amount of inflammation that you have in that area. If you use heat, it must be a moist heat. If you use a heating pad, that will just bring the blood to the surface of your skin. We want to get that moist heat in there because that will bring more blood into that area to help loosen up those tight muscles. The other thing that we tell patients to do is really watch their posture. If you have neck pain and you have your shoulders that are rounded forward, that will create like a shearing pressure on your neck. So we want to make sure that your shoulders are back and down. The other thing with the low back, patients that have low back pain, we say not to sit on a saggy couch or a saggy chair. Typically, they'll have better results if they sit in like a kitchen table chair or some chair that has a lot more support, because that prevents the low back from rounding. The other tip that we like to give is patients to watch the way they move. In other words, if they have low back pain, no matter what type of injury, if they bend with a twist or that combination, that's going to create an extreme amount of pressure on all the structures of the low back. So we encourage you to keep your chest up, keep your head up, and that will allow your low back to stay a lot more stable when you do need to move and make certain things happen during your day. Another really important thing for low back and neck is the way you sleep. If you sleep on your stomach, that is the worst thing you can do for your neck and for your low back. So we suggest laying on your back. If you still have pain while you're laying on your back, in your low back, we suggest getting a couple pillows that will go underneath your legs, and that will actually flex your hip, and that will flatten your back, and that should take away some of that pressure that you're feeling. Your pillow is also really important for any neck pain that you have. Many people get that pillow in the wrong position. They'll put that pillow up at the top of their head and that forces their chin down. We suggest getting that pillow down here and actually tilting your chin up. That will put your neck in the correct position and allow for less strain or stress throughout the whole night that you do try to sleep. A couple other things that we like to give our patients just to kind of get things going to loosen up is a couple basic stretches. And I start most of my patients off with these stretches. So let's go through them here. With these stretches, you should never have any pain. If you have pain, then you're either stretching too far or this is not the right stretch for you. So the first one is real simple. All you're going to do is bring your knee to your chest. So you can do this while you're laying on your back, on your bed or the floor, or you can do it seated. And all you're going to do is just bring that knee to your chest. You can kind of bring it across your body, out to the side. But that's going to stretch your hip area, which is directly associated with how your low back is with tightness. So I suggest holding that stretch for 3 to 5 seconds and then relaxing that stretch. 2 sets of 10 reps for each leg, no matter what side that pain is on, is the best way to try to stretch that area out. The other one is more of like a yoga move, and we call this on all fours. So this one, you're going to get on your hands and knees, both about shoulder width apart. You're going to relax your low back so it feels like it dips down. And all you're going to do is come back down real nice and slow. Okay? This is not a big stretch like you're stretching your hamstring, but it's designed to gently decompress that low back. You're going to hold that for like 3 to 5 seconds, and then you're going to come back up. If you have pain along the way, do not go down that far. So if you have pain right here, that you would stop right before you get that moment of pain. For your neck, the one thing that we suggest not to do is anything in a circular motion that is really quick. What we suggest is to use your hands Slowly use your hands to bring down your chin. In other words, do not use your muscles to actively bring your head over to the side. So you would take your hand, bring it down just to get a slight stretch, hold it there for 3 to 5 seconds, and then relax. If you have any hint of extra pain with any of those stretches, then we suggest that you do not do those stretches and seek further care to help. Um, this may help you, decrease your pain a little bit, but our whole goal when we work with patients is to find what works for them. These are some of the basic things that we talk with our patients and spend time discussing because we want to give them the right things to do right from the beginning to help get rid of their pain. Um, and lastly, we went over 5 specific things that you can try to do at home. I want you to contact me directly with some information that's personal to you about what is going on, and I will give you 2 more things that will be specific for your condition. Thank you.